Hi, Dr. Tammy Penhollow, talking with you today about the use of prolotherapy or hydrodissection in the treatment of painful conditions. The hydrodissection is used often around a nerve that has been entrapped. Think the carpal tunnel. Think the section where you've had your knee replaced, or if you've had several knee scopes and you still have some pain on the outside of your knee. There's also a very common on the inside of the knee, right where the femur ends and then the tibia begins, and there's that little nerve called the saphenous nerve that often gets entrapped with scar tissue and fibrosis. And hydrodissection can open up that area and free the nerve. So nerve pain is typically something that is burning, electrical, zinging, tingling, and by untrapping that nerve, freeing that nerve, it allows it to transmit the signals appropriately to the spinal cord and then to the brain and can provide some significant relief. So I do use that. Typically it's all ultrasound guided, and that way you can see the needle specifically around the nerve, not within the nerve, and you can see dissection around and kind of fluffing up and plumping up the area around it, so it gives the nerve-free realm of travel and transmission of the pain signals or just the regular proprioceptive signals. Another thing we do is prolotherapy with a a dextrose solution, and that can help with ligaments that are too lax. Typically, this is within the pelvis, the sacroiliac joints, the ischial-tuberal joints, the interspinous ligaments, even in the neck after a whiplash injury or in the low back. Oftentimes these ligaments are destroyed with a surgical procedure where they are cut and everything's retracted open, and then when the ligaments come back together, they are not as strong and they can be lax. So we can tighten those up with a dextrose type solution. I also use it quite often if I'm trying to just kind of stabilize the whole pelvis area in people that have some instability, and that can be even as simple as after pregnancy, when one of the hormones of pregnancy basically is called relaxin, and that relaxes all the muscles to allow for the expanding uterus and then the passage of the baby through the birth canal. So after pregnancy, a lot of women have some pelvic pain issues that can potentially be related to the unstable or loose ligaments there, and we can use prolotherapy to address that. So there are just a couple other areas that we do, not just PRP, not just bone marrow aspirate concentrate, oftentimes in concert with, and I'm happy to speak with you about it. Just give us a call at precisionmedprp.com. Thank you.